10 most frequently asked questions of the week about Inspire Primary Care. If you are new here, welcome. I'm Dr. Jade. I'm a board-certified family medicine physician and weight loss specialist. I own a private practice in Las Vegas called Inspire Primary Care. If you are joining, drop in the chat, where are you joining from? Here we provide 5-star primary care and medical weight loss services, all for a flat monthly or annual membership. And you guys sent in some really, really great questions. I actually had to break it in two. So I'm going to today answer the more primary care focused questions. And then on a future live this week, I'll come back and answer the questions you guys asked specifically about weight loss and our medical weight loss program. So thank you so much for submitting so many great questions. As you join, where are you joining from? And if you have any questions as you're watching this live, drop them below. I'll answer your questions live as well, and I'll go through the questions that were submitted to me over the course of the last week. I wrote down the top 10 most frequently asked questions, primary care related in this one. We'll do medical weight loss program related in the next one. But the top 10 primary care focused questions that you guys asked over the last week, I wrote them down. And so we're going to go through them. And if you have any other questions, I'll be watching the chat and answering your questions too. So the first question I got asked over this last week was, in your marketing, you say that there are unlimited text, unlimited emails, unlimited visits. Is it really unlimited? Are there any hidden fees? Are there any copays? So yes, that is correct. At our practice, it's unlimited primary care and medical weight loss services for one flat monthly or annual membership. There are no hidden fees. So my patients can text me during business hours. I text them back between patient appointments. It comes directly to me. It does not go to an assistant or an answering system. It comes to my phone and I text them back. Okay. Emails are 24/7. So that is the one component that if it's after hours or a weekend, our members can email me. Those emails come directly to my email and I email them back within a business day. If they text me, and those are during business hours, the text messaging access, if they text me, I text back between patient appointments. They typically will get those answered the same day if they, text me before like 4 p.m. before we close, okay? So text messages are answered same day. Emails are answered within one business day. And our members have their own QR code and link, and they self-schedule their own appointments, and they get to choose if those appointments are in person in our office or if those appointments are via video or via phone. In their QR code or link, it has the options for phone, video, or in person. They choose how they want the video, and if they choose how they want the visit. If they select video, I hop on the video with them at the time that they selected. If they choose phone, I call them at the time of their appointment. And if they choose in office, they text me when they get here. I bring them back. There's no waiting. Okay. So that's how it works. And no, we don't do copays. Everything is covered under your membership, all of your care, which is 90% of your healthcare needs. So let me know if there's any questions about that. I see you all joining. Thanks so much for joining. Dion Nutri, I see a wave. Hello, hello. And if any of you are joining, I'm looking at the chat for your questions. I'm answering the top 10 questions that were asked over the course of the last week. Okay. Number 2 question that was asked is, do you accept HSA and FSA cards? So my answer to that is yes. Our business accepts cards. Okay. We accept any card number. It's up to your company, though, if they will accept our service as an acceptable medical service. So what that means is we accept your card. You can use it on our end for HSA, FSA. It can cover your membership. Some of our members use their HSA or FSA cards as a monthly membership card, and some of them use the card and pay for the annual membership. That is up to you. Yes, we accept it. The only caveat is we've had a handful of people over the last 2 years, maybe 4 to 5 members who joined, and on the back end, their company told them that it was not an acceptable service on their list of services that are accepted, and then they had to switch and use their personal card instead of that HSA or FSA card. So I let people know, yes, we accept it, but check with your company and make sure that they accept our service as a service on their list, okay? Or you can join and use it and just be prepared that if it gets denied on the back end for some reason, then be prepared to use your personal card. All right, let me know if there's any questions about that. The number 3 question that was asked, most frequently asked question over the last week was, What is the cost of primary care membership versus if I have a child? And this is a good question because a lot of times it's adults calling about their adult child. And so if a member is joining and they are over the age of 18, that is considered our adult primary care membership, which is $149 a month. And if the child is under the age of 18, so 0 to 17, and they're joining with an adult, then the child or the pediatric discount is $49 a month per child. So that is if they're under the age of 18. If you have a child and they're like 25, that is considered an adult membership. Okay, number 4 question that was asked. Okay, so $149 for adults over 18, $49 for a child 0 to 17 joining with an adult. And if they are doing medical weight loss and primary care in our practice, that membership is $199 a month. So we are all about price transparency. I always want you all to know what things cost. The next question, number 4 question that was asked is, can I pay annually instead of monthly? I prefer to do a one lump sum payment instead of having a monthly recurring membership fee. The answer to that is yes. We have both options. We have the option for a monthly membership, that's $149 a month, and we have, if this is for primary care, and we have the option for an annual membership, and we do waive our $49 enrollment fee for those who choose the annual membership. So that cost is $17.88 if you are doing the annual membership. I had quite a few people call in and tell me that they received their tax refunds and they wanted to pay the annual membership. We have had several people do that over the last week. And yes, that works. You can do it as annual, one lump sum, and then your membership is covered for a year, or you can choose the monthly membership. It's up to you as the member. We do have both options available. All right. I see some of you joining. Drop in the chat, where are you joining from? And if you have any questions about Inspire Primary Care, drop them. I'll answer your questions live. All right, we're going over the top 10 asked over the last week. Number 5, okay? And so the number 5 question that was asked, frequently asked question over the last week is, do you do pap smears? And do you order mammograms? Or do I have to go to the OB-GYN for that? All right, so yes, I do pap smears. I know this can be confusing. I am a family medicine physician. I am a weight loss specialist, but I do full spectrum non-surgical gynecology services, meaning if you have vaginal discharge, I can work that up. If you have any vaginal concerns that don't require surgery, I can work those up. If you need your cervical cancer screening in the form of a pap smear, yes, I do those. We do those in office. They are included in your membership, just like all office procedures are included. So yes, I do pap smears here in my office, and mammograms, I do order the mammograms to our imaging center. So our members who are established with an OB-GYN, and if they prefer to continue going to their OB-GYN for their pap smear and their mammograms and their women's health needs, they can choose to do that. Or if they want to just get those done here at Inspire Primary Care, they can do that as well. Okay. So yes, pap smears, mammograms, women's health concerns, we do them here. If there is a concern that comes up that requires surgery, then that's when we would refer you to OB-GYN. And I help you know when we need to refer out, which leads to the number 6 question, y'all. I'm seeing in the chat, Bodine 166 says, hey, boss lady, hello. And you are from Jacksonville, Florida. Florida's in the house. Welcome. Where else are you guys from? Drop in the chat if you have any questions. I'm going over the top 10 questions asked about Inspire Primary Care over the last week, and we are on question number 6. I got asked, do you do referrals to specialists? And yes. Although our services here at Inspire Primary Care, our monthly membership and our services do cover about 90% of healthcare needs under that membership, there's about 10% of care that is not going to be covered under our membership. That's going to be if we need to refer to a specialist. So yes, if you need to see a specialist, I do place referrals for you, and you would just use your insurance card if you have insurance at the specialist office, or they may have cash rates if you don't have insurance. The other things that are not covered under the membership would be things that basically needed outside of our office. So in our office, everything is covered. If it's outside of our office, that is when you would use your insurance card or our discounted cash rates for our members. That's going to be like at the pharmacy. You can use your insurance card, or we have pharmacy discount coupons. At the labs, you can use your insurance card, or we have cash discounted rates exclusive for our members. Same thing at the imaging center, okay? So Anything in-house is covered. If it's outside of our house, which is about 10% of care, that's when you can either use your insurance or use our discounted cash rates. I hope that makes sense. But the answer to your question, number 6, was, do you send referrals to specialists? Absolutely. Number 7, question that was asked is, do you send medications to the pharmacy, and how does it work when I need medication refills? So yes, when you come to our onboarding appointment, I ask you what is your preferred pharmacy and what are the cross streets. So if you say Walgreens on Lake Mead and Nellis, for example, then I just put that in the system, and anytime you need a medication sent, that is where I send the prescription, okay? How do medication refills work? So basically, after that first onboarding appointment where you come in person, after that, I have your physical exam, I have your vitals. Most things can be triaged virtually. Most things I'm able to either coordinate with my members via text, via email. We hop on phone, we hop on video. There are very few things that we really truly need you to come in office for. That's the difference of going to an insurance-based office where they require you to come in so the insurance can get paid, which is they need to take that copay, versus a membership model. We don't need you to come in and waste your time if it's unnecessary. So many things we can do virtually. And so most of the time, my members will just text me what they need. For example, if they wake up with a urinary tract infection, they'll text me, hey, doc, I woke up with burning with urination. It's been for a day now. It's just like my other urinary tract infections. I say, all right, your medication's at your pharmacy. I don't need you to come in for anything for that, okay? Pretty straightforward. So yes, I just send those to your pharmacy. Same thing for medication refills. If my patient has blood pressure medication, they're stable on that, there are no changes that need to be made, they text me when they need refills, I send the refill to their pharmacy. Very easy, very straightforward. It doesn't waste either of our time, okay? We are all about efficient, high quality care. And so number 8 question is, what about office procedures? Did you say that they're free? I have these skin tags. Can they be removed? And do you remove any number of skin tags for free? And are there any hidden fees? So again, yes, all office procedures are included in your membership. We have a whole list of our in-office procedures listed on our website. You know, common ones we do are going to be ear wax removal, so like ear flushing. We do joint injections, typically in the knee is the most common joint injections. Let's see, pap smears are considered an in-office procedure. If you happen to cut yourself open and need to be sewed up, laceration repair is included in our membership. So there's a whole gamut of office procedures that we do. And yes, they're all included in the membership. And the question about skin tags and is there a charge per skin tag? Like, it's all included, y'all. There are no hidden fees. So for example, last week we had a member who scheduled, again, our patients have their own QR code and link. They self-schedule their appointments. Of course, if it's an office procedure appointment, they're going to schedule that as an in-office appointment. And they just put in the comment box what type of visit it is so I can already be set up. So they had self-scheduled a skin tag removal visit. And I had everything all set up when they got here. I just told them, okay, show me where the skin tags are. They showed me all the skin tag areas. They had maybe like 6. And we removed all 6. There's not like a separate hidden charge. We just remove what's needed. So that's pretty much it. Office procedures are included. Yes, no matter how many skin tags you have, it is included. And there are no hidden fees when it comes to that or anything else in our practice. Number 9, drop in the chat if you're just now joining. I see you all joining. Drop in the chat. Where are you joining from? And if you have any questions about Inspire Primary Care, I will scan the chat and answer your questions. We're going over the top 10 most frequently asked questions over the last week, and we are going to answer question number 9 and 10 next. I'm scrolling the chat. I see Robert Rogers says, proud friend. Thank you so much. Know me since high school, maybe middle school, and thank you. It's exciting to definitely be back in my hometown providing high quality healthcare to my hometown community. So number 9, okay, number 9 is, what if I need a work note? I like this. So what's so silly about the insurance-based offices is the literal need for insurance companies to get compensation. They have to have you come in. there are certain checkpoints that they need, like for the nurse to take vitals, for, them to get your weight. There's just certain checkpoints that insurance needs for the practice to get compensation that require for people to come in the office, even when it's not necessary. Okay. So my members, I know them. I've already met them in person that first onboarding appointment. So from there, they can again schedule in office or virtually. So I know my members. I know what they do for a living. I get to know them. I know their kids' names. Okay. It's literally like having a doctor in your family. So when my patient texts me and says, "Hey doc, I don't feel good this morning. Can you send over a work note?" I don't have a question about that. I text or email them their work note and they're able to continue to recover from home. I don't have people that are unreasonable and are asking for 6 months off or a year off. It's like, I need a 3-day work note so I'm sick. And so the work note's at their email. So when people ask, what if I need a work note? It's included in your membership. It's just direct communication. You let me know what's going on via text or email, and your work notes at your email. And we go from there. Okay. And of course, if they need any prescriptions, then I send it to their pharmacy and we keep it moving. All right. And then number 10, y'all. The final question, frequently asked question that I was asked over the last week is, are you available 24/7? I like this question. So you all know that a big part of what we do here at Inspire Primary Care is all about direct physician communication, direct physician access. That is one of the main benefits of being in a membership medical practice versus an insurance-based practice. There are no barriers to getting directly to your doctor for your questions and concerns. So the question of, are you available 24/7? The answer to that is no. Okay. I have a family. I have a life. However, I give my members lots of high quality access. So what that looks like is, my patients, again, have my direct cell phone number where they directly text me during business hours. That's Monday through Friday, 8 a.m. to 5 p.m. That's a whole lot of access, whole lot of direct time to directly text me if they have any concerns. Our members know that if they text me Monday through Friday, 8 to 5, they text me, I will answer those text messages between patient appointments. Okay. If they text me after 4 p.m., depending on how many text messages I have, they may get a response from me the next business day. All of our members know this. They also know that they have my direct email. And if they email me, that is a 24-hour access where they can email me anytime, including after hours or weekends. However, I will respond to those within one business day. So if they send me a text message Sunday or an email, if they send me an email on a Sunday, they will hear from me Monday. If they send me an email Wednesday at 2 a.m., they'll hear from me the next morning when I get to the office. So very easy, straightforward access, efficiency once again. And then from there, they self-schedule appointments. They self-schedule the phone, video, or in-person appointments with their QR code or link as desired. Okay. And then let's see. So those are the top 10 questions, y'all. And then the last bonus thing is, are you taking new members? Yes, we are enrolling new primary care and medical weight loss members to our practice. I will come back and do the top questions asked specifically about our weight loss program, because you all asked a lot of great questions about that. So I just kept it separate. I've more so answered the primary care related questions today. I will come back later this week and answer a separate live on your most frequently asked medical weight loss program questions. Okay, so you can continue to submit those to me as you see. If you DM me, if we do meet and greets, if you ask me questions, I will come on live and answer those, because I know if one person has the question, other people have the question. So yes, we're now enrolling new primary care and medical weight loss members. You're wondering, how do you join? It's at inspireprimarycare.com. No I in front of Inspire. There's a big button at the top of the website shaped like the Las Vegas sign. It says enroll in the middle. You click the button. It takes you through the steps to join the practice. Very simple, very straightforward. I am scrolling the chat now. I have a few more minutes before my next appointment. So I'm scrolling the chats to see if y'all have any questions. So drop them now if you do. I'm going to take a sip of water as I read the chat. There's quite a few of y'all here today. Where y'all joining from? Thank you so much for being here. Thank you for your questions. I know a lot of y'all like to submit the questions via the DMs. That's okay. If you do, I'll come back and answer them in a separate live. All right, so scroll in the chat for y'all. I see Hope Fletcher Porter. Hey, sis. She says, hey, queen. All right, and then let's see. Kiana Oliver says, dermatology. Would you have a limit on seeing patients for needs regarding skin besides skin tags? Okay, so that, and then there's a part two, so I'll answer that question first. So the question about dermatology, yes, I have in my training, I had a very in-depth dermatology training. I trained with some of the best dermatologists in Loma Linda in California, and I had many dermatology rotations, meaning I do a lot of dermatology, okay? I'll have patients join and they come to me and they're like, hey, I have acne. Can you send a referral to dermatology? And I'm like, girl, no, I do that. That's what I do. And so that's just one of the dermatological concerns, right? But absolutely. The thing about coming to a wellness focused full scope physician is I have a lot of depth in a lot of different areas in each specialty, but I know exactly the time when we should refer. And that is going to be a specific person to person. So, for example, if we are dealing with something like vitiligo, I may or may not, depending on what you've already tried, I may or may not refer right away, depending on where we are. For something like HS, okay? I will definitely get dermatology on board with something like that. So I'm going down the rabbit hole of absolutely, besides skin tags, I do lots of dermatology, eczema, et cetera, et cetera, et cetera. You do not have to go straight to a specialist. Most of the things my patients need when it comes to dermatology, they literally just text me a picture of their skin. I'm able to diagnose most things with a picture, and then I'm sending their prescription to their pharmacy. Or they're letting me know what's going on, and if we've tried one or two things that are primary care appropriate, then we'll refer to dermatology from there. Or if it's something that right away I know we need dermatology, we'll send the referral, and I'll also do the appropriate workup while they wait for that appointment. So hope that answers your question on that. Let me know if you need any more clarification on that. Absolutely. We do a lot of dermatology in this office. And of course, we also refer to our dermatologists when needed. All right. And then that was a great question. Thank you, Kiana. And then Kiana had a part two, and it says of her question, and it says also, can you share more about the medical weight loss info as far as consultations? I'm curious. So yes. So Kiana, I'm going to come back because I've been getting lit up about medical weight loss questions. So I'm going to come back later this week, probably Wednesday or so. So later this week, when I have a break between patient appointments like this, I'll come on and answer all of the frequently asked medical weight loss questions asked over the last week. However, if you go to our website at NSPIREPrimaryCare.com, no I in front of Inspire, there's also a button right at the top that says click this to schedule a free virtual meet and greet with Dr. Jade. And I can answer all of your personalized wellness or medical weight loss questions. So yes, we do free 15-minute consultations through that link. Let me know if there's any questions. If you have any specific questions about the medical weight loss program, feel free to either schedule a meet and greet or DM me the questions and I'll answer them on the next live. But I'd love to answer your questions and get your questions answered. So definitely book a meet and greet with me, okay? All right, I see the heart that you dropped. I'm glad that was answered your questions. Thank y'all for being here today and asking such amazing questions. Thank you to those who submitted questions prior to this, okay? And I will come back and answer any questions that you guys drop in the DMs or in the comments after this video. We'll come back and answer those as well. Again, we are enrolling new primary care and medical weight loss members at InspirePrimaryCare.com. No I in front of Inspire. If you're in the Las Vegas area, I get asked this a lot. Can I care for you, or can I be your doctor if you live in another state? No, our medical services, I am licensed in the state of Nevada, so all of my medical services are for Nevada residents. So if you're in the Las Vegas area and you're looking for high quality primary care or medical weight loss services, I'd love to care for you. InspirePrimaryCare.com. No I in front of Inspire. Have a great day, everybody. Bye.